More Indian states are tightening COVID-19 restrictions. Gujarat and Punjab are the latest to step up measures. A night curfew has been imposed in 20 cities. Large social and political gatherings have been banned. The new measures will be in force until the end of the month. New Delhi and Maharashtra have also imposed stricter rules. India has recorded more than 115,000 new infections. It's the country's biggest jump in daily cases since the start of the pandemic. The surge has amplified pressure on the government to expand its inoculation drive. But many states are facing vaccine shortages. Neha Punia joins us for more on this. Neha, it's the second time this week that daily case numbers cross the 100,000 mark. India's outbreak seems to be getting worse.
On Monday, India recorded just over 100,000 cases, and just 2 days later, the country's caseload has already breached that mark. And experts say this is a sign of things to come, and that the situation in the country will get a lot worse in the coming days before it gets better. This current peak expected to peak around... This current wave, expected to peak around late April, mid-May. And the result of this surge in cases is actually already showing up in hospitals. Many people going on social media, sending out SOS messages saying they're unable to admit their loved ones in hospitals in cities like Mumbai and Delhi, where hospital beds are quickly filling up. The government says the surge is a result of citizens being careless. It says because people are no longer wearing masks and maintaining safe distancing, these numbers are going up. But a lot of criticism going the government's way as well, because while the government is blaming this surge on regular citizens, it has not banned political rallies in 4 poll-bound states where all political parties are holding campaigns where you can see tens of thousands of people without any masks in sight and clearly defying safe distancing norms. So, there is anger among the general public here that it's unfair of the government to blame general citizens. But what's happening as a result of this surge is many states are now going back to limited lockdowns. Many regions now imposing limitations on how many people can gather in public spaces. And experts are warning that these sort of restrictions might be here to stay for a while at least.
And Neha, this surge in cases is expected to also affect the country's vaccine exports.
We've already seen vaccine exports slow quite considerably. The last export out of the country was last Monday. We've not seen any new consignments being sent out. But even as the government says it wants to prioritize India's own immunization drive, there are many states who are complaining of vaccine shortages. Odisha, for example, has said that vaccine supply to its vaccination centers has been erratic. Maharashtra, which is India's worst hit state, says it only has enough vaccines to keep its vaccination centers running for 3 more days, and as a result has to shut down several vaccination centers starting today. The government has denied it, saying there's no vaccine shortage. They'll keep feeding vaccines to states as and when they need them, but at the same time saying it will not expand vaccinations to cover all citizens, something that many states have been asking for. But on Wednesday, the government has said that workplaces, both private and public, can tie up with vaccination centers to get their employees vaccinated. So certainly the government giving into some of that pressure that's coming its way to ensure that the vaccine program is expanded beyond the current essential workers, senior citizens, and anyone above 45 years of age as cases keep rising.